My name is Kailash Mantry. I am a life coach and a mental health consultant. For the last 25 years, we have been researching on more than 50 mental illnesses and we have been successful in curing all without medicines. Today we'll be talking on anxiety disorder. Now let's understand what are the present prevailing treatment options people have for anxiety disorder. Let me tell you, medicine has got no role to play in curing anxiety disorder. But first, people go to a psychiatrist, he gives them some anti-anxiety pills, and for some time they feel good also, because what the tablet does is weakens the nerves and make them sleep, and it is a way of forcing them that they should not think. Second option people has got is go to a psychotherapist. He will keep on analyzing and will come to the conclusion that your thinking is wrong, you should stop thinking. But he doesn't have a solution as to how to stop the mind, how to stop negative thinking, how to stop the fear and the constant worry the patient has got. Now there is one more therapy developed which is called CBT, Cognitive Behavior Therapy, which deals with the symptoms of the disease and try to control the symptoms. None of these therapies can help you because they are all dealing with the symptoms and not with the root cause. Now let's understand what are the root causes of anxiety disorder. Fear, nervousness, failures, rejections, sadness, seriousness, excessive thinking, negative approach, doubt, lack of confidence, disconnect with their family members, loneliness, and there are more than 100 to 200 such reasons why people have anxiety disorder. We have developed a very transparent test and a very simple test, and the name of this test is mind mapping. And within 15 to 20 minutes, the patient himself realizes what are the root causes of this anxiety disorder, and we start removing one by one. Normally we take around 10 days to cure this disease, but sometimes it may take longer also, but definitely not more than 30 days. Now there are 5 categories of anxiety disorder. First category is panic attack. In this category, person suddenly panics, becomes breathless, starts sweating and is uneasy for a short duration, but is experiencing death in this short duration. After some time he becomes normal, but these attacks keep coming at least 5 to 8 times in a year, and the memories of these attacks are so horrible that he remains uneasy for the lifetime. Second category is social anxiety disorder. In this category, people avoid meeting people fantasize rejections, failure in communication, as if they are a laughing stock, people are laughing at them, and whenever they are in contact with people, they get this attack. They become very uncomfortable around people and always try to avoid going into public places. Third category is specific phobia. Here, whenever they have to do something which they have not done earlier, they get phobia. Like traveling in a plane, they get panicked, they get breathless, they experience death, and they are very uncomfortable traveling in a plane. But once they have traveled 3 to 4 times, this disorder disappears. But there are many reasons to have these disorders. Sometimes it could be, seeing a cockroach, seeing a snake. Sometimes even insects can create this panic. And the fourth category is GAD. GAD stands for Generalized Anxiety Disorder. Here they have worry for day-to-day activities, they avoid working, and everywhere they fear that something wrong will happen. And the last category is Separation Anxiety Disorder. Here, although there are no evidence, but still they feel if the marriage partner, if the marriage breaks, if the parents leave them, if some accident may happen, somebody will die, they constantly attract all these things and create anxiety for themselves. Sometimes there is no evidence for all these things happening, but they imagine that it has happened and they start worrying about it.